Hello, my name is Carolin, and I was in the Science Internship for Nursing program this year at Fairview Hospital. I will be attending West Virginia University in the fall. The title of my research project is Lighting in the Recovery Room and its Effect on the Recovery of Children. Introduction. Pediatric pain is complex. It involves the interaction of physiological, psychological, behavioral, developmental, and situational factors. Children experience pain that is not only affected by the presence or absence of caregivers, but also by fears related to unfamiliar surroundings. As one would assume, a quiet, dark room can help a child go back to sleep. Different lighting is needed for particular situations. People's moods are affected by different types of lighting. It has been noted that artificial lighting may cause aggression, irritability, and nausea in children. Hypothesis. Does lighting have an effect on a child's recovery period post-anesthesia? Methodology. A literature search on articles related to the topic of discussion was made. The keywords included light, dark, health outcomes, children, anesthesia, pediatric surgery, parents, and recovery room. A CINAHL search was completed. The following were the results found. Lighting had 1,284 results. Lighting in children, 0. Children recovery time, 0. Pediatric anesthesia, 1. Pediatric surgery, 36. As a result, from lack of information in CINAHL and Medline, a Google search was performed. The results were filtered as to relevance to the hypothesis and were 7 in number. Other methods include guidelines from other recovery rooms being noted, patient and parent preferences taken into consideration, and observations of nurse practices in a clinical setting. Collection method. 72 patients were available for observation and review. The patient population consisted of children 0 to 18 years old. The variables that were recorded include age, surgery, was the child crying or calm, were the lights on or off, parents' time of arrival, and whether the child was medicated or not. Initial observation results. The pediatric patients can be split into 2 categories, lights on and lights off. Out of the 37 patients with the lights on, 19 were crying and 18 were calm. The remaining patient recovery rooms had their lights turned off, with 8 crying and 27 calm. The 2 pie charts represent the preceding numbers found. With the lights on, 18 were calm and 19 children were crying, whereas with the lights off, 27 were calm and 8 were crying. The following graphs portray the comparison of outcomes with the lights on and the lights off. With the lights on, there appears to be more crying in pediatric patients, with or without medication. The lights off graph shows higher numbers of the patients being calm. Lights on. As you can see, there are a higher number of patients that are crying than are calm. And then with the lights off, there are fewer patients crying. Potential outcomes. With the lights off, pediatric patients experience calm post-anesthesia stay, resulting in a decreased recovery time and less need for post-op pain medication. Recommendations. Continue this study with IRB approval, and since there was no research on the subject, further research on this topic should be made. We should also now be more interested to train nurses on non-drug pain relief methods. References. Special thanks to Michelle Duns, Elizabeth Hawk, James Thompson, John Harrison, Catherine Pouts, and Nedra Starling. I hope you enjoyed my presentation. Thanks for watching.